How you doing? I hope you're taking care of yourself. And I wanted to bring you some good news about, of course, the shutdown of America. First, we have to see how we're doing on the numbers. I do have all good news, but we have some numbers coming in from the testing. And they look big, but I don't want you to get too riled up. First, let's hear the hard numbers. The number of infected seems to be over 124,000. They've now cured 3,200 plus, and the deaths are at 2,200 plus. So, Jesus, please bring these people into your kingdom and take good care of them, and all the people who've died from these horrible viruses. Influenza continues to take 10 times this amount of people every year. So again, let's take a look at these numbers, and I would like to really show you this video. Again, I showed a little bit of this in my last video, but it's really important that we compare this to 10 years ago. Now, I keep tricking everyone, telling them, oh, look at this video, and they think it's happening right now, but it's not. This is for 10 years ago, okay, the H1N1 virus.
Today's numbers are about 4 times higher than what the CDC reported just 6 days ago.
Oh, I know. Our estimates, we believe, give us a better estimate of how much disease, hospitalization, and death there is.
The government now believes roughly 8 million children have come down with the virus.
It's children.
In addition to the 540 who have died, 36,000 have been hospitalized.
540 dead.
Among adults 18 to 64, there were an estimated 12 million cases, 53,000 hospitalizations, and almost 3,000 deaths.
What we are seeing in 2009 is unprecedented.
But the agency insists
These are
the
early
outbreak
estimates,
hasn't
my
actually
friends.
worsened.
This went to
Instead, the numbers now include
17,000
cases that
deaths.
previously had been missed.
Okay, so
We
I
have
don't even
underreporting of
wanna
cases
know
for
how
several
many were
reasons.
children. I
Not
don't
all
even wanna know
patients
that
who
number.
actually die from this are detected, meaning that they don't even realize the hospital has what they have. In some cases, they suspect it but can't confirm it because the right tests weren't done. Or third of all, because of the fact that it just doesn't get into the system.
Still, the 3,900 estimated deaths are only about 1/10 of what we usually see
Boom.
in a typical entire flu season.
36,000
The CDC said the supply of
a year.
H1N1 vaccine continues to increase. As
My
of today,
friends,
almost
where was
42
the-
million doses are available. Katie?
Dr. John LaPook. John.
So where was the stock market crash 10 years ago? Where was the outrage? But I know it's different. It's infectious. It's very infectious now. And so we have to make sure that there's not, a huge threat. So like I said, here's some good news. But before that, I want you to see this one other thing. Tucker enlightened me to the fact that they're really being so unfair to the president. They called him a racist early on, and for closing the border to China. I mean, flights coming in or whatever, and screening those coming from China. And honestly, I gotta take my hat off to him. He did a good thing. I think he lessened the problem significantly. So they were calling him a racist for that, and at the same time now they're saying he's not doing enough for New York, and I thought this was
So
very
you saw what's
interesting.
happening in New York. The question is, why is the outbreak so especially devastating there? New York City is the densest metro area in the country. That's the most obvious answer, probably the biggest problem. The city also has an awful lot of people traveling to and from other infected countries, and that's significant too. But it's not the whole story. As this deadly virus emerged from eastern China and began to spread inexorably across the globe, clearly headed here, leaders in New York not only failed to shield their citizens from it, They took affirmative and aggressive steps to increase the risk to their population. Why would they do that? Well, because they were worried far more about being called racist than protecting human lives. That's not an overstatement. That's not hyperbole. Watch the city's health commissioner, Osiris Barbett, urge New Yorkers to spend as much time as possible in crowded public places. Keep in mind, this video was from February 2nd of this year. That was long after the threat from the Chinese coronavirus was obvious to anyone who was paying attention.
The risk to New Yorkers for coronavirus is low, and that our preparedness as a city is very high. There is no reason not to take the subway, not to take the bus, not to go out to your favorite restaurant, and certainly not to miss the parade next Sunday. I'm going to be there.
It's okay. I mean,
take the subway, go to dinner. People cheer. They feel good about themselves. Future generations, though, are going to watch that video with their jaws open in disbelief. How could someone charged with protecting public health so recklessly endanger it? They'll watch this performance from State Senator John Liu, too. Liu suggested that people who might be concerned in any way about contracting a deadly disease, or who might be interested in where it came from, must be, and you guessed it, bigots.
But there's really no need to panic and to avoid activities that we always do as New Yorkers. We are a hardy people. As an Asian American, I've been somewhat disturbed, if not outright appalled, at some of the comments or gestures that I have seen. Diseases originate from anywhere or from particular places in the world.
In other words, as a member of a protected interest group, I'm ordering you to ignore this threat to your family on moral grounds.
It's just insane.
Go to the parade or else. That's what Liu is saying. Let's hope that in the wake of this disaster, after John Liu has lost his job and we can all think clearly again, people will stop talking this way in public for good.
Yeah, and, you know, there's a lot more to that, but I'll let you watch it. Now, here's the good news. Now, I know I'm just rolling, but you have to watch this.
Welcome to Waters World. I'm Jesse Waters. Vanquishing the virus, that's the subject of tonight's Waters Words. Knowledge is power. We're going to show you a video from a New York City doctor. It's going to change how you think about this whole thing. His name's David Price. He works at one of the best hospitals in Manhattan and is on the front lines in the fight against coronavirus. We're extremely grateful for his work. And what he says in this video is going to help you understand how the virus actually infects you and what you need to do to stop it from getting into your body. And here he is in his own words.
You may hear a little inflection in my voice, like I'm emotional. It's not because I'm scared. It's actually the opposite. For the first time in a while, I'm actually not scared. I work at probably the premier hospital in New York City. Our hospital is almost exclusively a COVID-19 hospital. But we're learning, and we know a lot. And what I want you guys to know is that every single day we're getting better. We know more. And I am confident that the stuff I can tell you today should make you guys feel like when this comes to your community, that you don't have to be scared and that you can protect your family.
What I'm going to play for you next is very, very important. Listen very carefully. This is how you actually get infected by the virus.
The way that you get this is the transmission of the virus almost exclusively from your hands to your face. From your hands to your face. And so it's either into your eyes, into your nose, or into your mouth. So there's a lot of talk about contact or getting it through contact, hands to face. There's also a small thought that it can be aerosolized, that it can kind of exist a little bit in the air. The thought at this point is that you actually have to have very long, sustained contact with someone. And I'm talking about over 15 to 30 minutes in an unprotected environment, meaning you're in a very closed room without any type of mask, for you to get it that way. But to very simply state, the overwhelming majority of people are getting this by physically touching someone who has this disease or will develop it in the next 1 to 2 days, and then touching their face. The thing that makes me smile a little bit is that I actually know now that I won't get this disease because I know how to protect myself.
Let's go over this again. You get the virus when your hands touch an infected person or an infected surface, and then you touch your hands to your face. Don't do that. And in some cases, if you're in a small sealed off space or room with an infected person for longer than 15 minutes or so, you can also probably get it that way. Now listen to these 2 tips coming up on how to prevent yourself from being infected by coronavirus.
So I just want to give you guys a few very, very practical tips to how to protect yourself. It's become a hand Nazi. Everything you know about your hands, just keep them clean and you will not get this disease. The second thing is you have to start psychologically working on the connection between your hands and your face. So someone at a party has this and you shake their hand, right? And then you touch your face. It's that simple. That is how you get this disease. Those 2 things combined is incredibly powerful and will prevent the transmission of the disease into your family in 99% of cases. To know your hands are clean and to not touch your face, period.
This is the key.
Guys.
If you listen to any part of the show, listen to
Good
this.
stuff.
This is straight from the doctor on the front lines. Keep your hands clean. Wash them all day long. Carry hand sanitizer wherever you go. You know, use your elbows or your shoulders to open doors, whatever. If you need to touch something like a grocery store cart, use the hand sanitizer before and afterwards. And please stop touching your face. That's how the virus transmits from your dirty hands into your body. It gets in your eyes, your nose, your mouth. So just be aware of where your hands are at all times. Wearing a mask is one way to train yourself to not touch your face. You know, you can wear a mask if you want.
This is
but just
great
don't hoard
news.
them.
This is easy
Do not
preventive
shake
news,
people's hands.
you know?
You can go
Prevention,
outside, but
an
just
ounce
keep
of prevention
the
worth a
6
pound of
feet
cure.
distance
Oh,
apart
yeah.
from
We
people,
haven't even
just to be
got
safe.
to the cure. We
And when
even
you
have
sneeze
a
or cough, just
therapy
do it in
that's
your elbow,
curing things,
not in your
and
hand,
we
or
haven't
definitely
even
just not
created
out in
the
the
cure
air.
yet. This is going to be great.
And shrink your
We're
social
going to
circle.
totally
The
dominate.
people that are
We're gonna
keeping large
destroy this thing.
social circles right
We're gonna come
now
out
are at a much higher
heroes
risk.
of the world.
Sitting in a
America's
small
gonna
area with
lead
someone
the way to
outside that
victory
circle
over the
with the door or
coronavirus.
window closed,
And
not a good
America's
idea
gonna
right now.
be great once again.
Most of the
and we're
transmission's
gonna
from
help
family
everybody
member to
else.
family member.
We're gonna
So
show
make
them
sure your
exactly
family
what to
member
do,
know these tips.
just like
We
we
will
always
vanquish
do.
the virus if we're smart and clean. 35 medical teams around America are racing towards a vaccine. The pace is incredible.
That's impressive.
Records are
That's
being
impressive.
shattered. Just last week, the volunteers
Yeah,
were
we could
given
sit
their
here and watch
first
this all day.
experimental dose. We're going to have a cure next year, and we'll have medicine in months.
And that's what we had 10
Dozens
years
of
ago.
paramedics
It did
are
not
doing an
take
amazing
long after
job
they knew there
taking
was
care
a
of our
problem
people.
that the H1N1
Starbucks
vaccine
is actually giving free coffee to first responders.
was available,
And
and
Saints
we lined
quarterback
up
Drew
for it.
Brees
That's what it
just
was.
donated
That was the
$5 million
only
to fight the virus.
rush that
Thank
there
you.
was. We
Testing
stood
has finally
in
ramped up.
lines to get
We
that
tested more people in
vaccine
8 days than
sometimes.
South Korea tested
But
in
by
8
the time
weeks.
I went over and got it, it
90% of the
was
people
just
tested don't
in
have
some
it.
drugstore,
And those
quick
that
and
do
easy,
usually recover quickly based on age and health.
everyone was fine.
The mortality rates are dropping. The United States and Germany have the lowest mortality rates of any country in the world.
That's really
We need
important.
to keep our foot on the gas.
That's where your stock
America
market
can't
starts
fall back.
dropping and dropping.
More
I mean,
ventilators and
going back
masks are
up,
needed.
going back up.
So is testing.
It was dropping.
So stay home
because
for now.
they were inaccurately
Stay smart
reporting
and
the death
stay
rate.
clean. My heart goes out to the
So
Americans who
that's
lost
what
their
made it
jobs and
drop.
their businesses. I'm so
We
sorry
only
if you're
knew
sick.
A handful of
We'll
people
make
were
America
infected,
healthy again.
And
The economy will
now
come
that
back.
we know a lot
Things
of people are
will
infected,
get
but
better.
They're not dying. They're not
We're all
dying.
in this
They're
together.
recovering. Even in China, recovering.
Earlier I spoke with the man leading White House Task Force, Vice President Mike Pence.
Now this is great. You should go on and listen to Mike. He will just, make you feel so much better. Again, all the news is good. There's nothing to worry about. Everything is under control. I think we actually overdid it a little bit because we really needed to protect our old people a little more than our, selves. But panic ensued. But the smoke is starting to clear. Things are settling down. The shelves are getting a little fuller now. The stock market's doing a little better now. We're going to win this fight, everybody. Nothing to worry about. Nothing to worry about. God's looking out for us. We're in God's hands, okay? Trust everything is going to be just fine. All right, take care, guys. Thanks so much for your time and for watching. See you next time.